Friends from the media, good morning. Welcome to the 11 o'clock press conference on COVID-19. Apart from the Chief Executive, we have the Secretary for Food and Health as well as the Chief Executive of the Hospital Authority. The Chief Executive will first speak before answering questions. Because of the epidemic, please keep your masks on and stay socially distanced. Chief Executive. Good morning, everyone. On the 9th of March, when I started the strengthened press briefing approach, the theme on that day was enhancing treatment for COVID patients. On that day, it was also the Secretary for Food and Health as well as the CE of the Hospital Authority with me. It's been almost 2 weeks. Once again, I will, together with my two colleagues, talk to you about our current situation. A number of measures have been put in place in the past 2 weeks. They are related to treatment of COVID patients. We have drawn reference from the views of mainland experts. We have put the emphasis of our work to reduce fatalities, serious cases, infections, and to accord priority on focused premises, organizations, and categories of people. The priority will be given to elderly citizens. My two colleagues will supplement. We have to strengthen the treatment for COVID patients. Within a very short time, we have expanded the treatment capability of the HA. We have significantly increased the number of beds for COVID-19 patients, and within a very short time, we have turned Queen Elizabeth Hospital, the main hospital of the Kowloon cluster, to become a designated hospital for COVID-19 patients. And for a number of other hospitals, we have enhanced their capacity in treating COVID patients. What we see after 2 weeks is that COVID patients will only wait for a much shorter time at A&E departments to get treated. Dr. Koh will supplement. The other area is that we have adopted a multi-level, multi-tiered treatment approach. So apart from the first 2 tiers of treatment at the Hospital Authority, we have also enhanced our facilities at the Asia World Expo, namely the community treatment facilities. Once again, I want to thank the support of the central authorities. Arrangements have been made for mainland medical team to come to help us. So far, we have close to 400 people in the mainland team. Shortly afterwards, Dr. Koh will also talk about the cooperation between the mainland team and the Hong Kong team and the current situation at the community treatment facilities at AWE. Within a very short time, under the multi-tiered treatment approach, we have also enhanced the capacity of the holding center for elderly people. Together with the Tin Shui Wai Center, we have now 5 such holding centers operating. They are Choi Wan Road Sports Center, Shakib May Park Sports Center, Harbour Road Sports Center, as well as the Tin Shui Wai Sports Center. There is also one at Kai Tak Cruise Terminal. The 4th initiative is to enhance our treatment capability. We have introduced the 2 oral medication for COVID, especially for Paxlovid from Pfizer. It was introduced in mid-March. Well, the efficacy has been mentioned by a number of experts. You can also hear from Dr. Koh shortly afterwards. The 5th initiative is to accord the priority to elderly people. Of course, then one of the priority groups of people are elderly people, and priority premises are residential care homes. We have created and added more holding centers to provide support to residential care homes so that they will be better supported in receiving residents coming back from hospitals. For those who are isolated at home, we have also provided support to elderly people being isolated at home. We have a caring queue to make early appointment at designated clinics. We've also made use of Chinese medicine in the treatment of elderly COVID patients. Yesterday evening, I have once again had a meeting with mainland experts. Mainland experts are of the view that the number of initiatives implemented in the past few weeks were to lay a good foundation for the objectives I have outlined. However, experts pointed out that every day there are still about 200 or so death cases. Risk for elderly people is still high, and there is a high possibility of them getting a serious condition. Vaccination rate for them is low, and we hear from time to time outbreaks or cases in residential care homes for the elderly. So we should remain vigilant. That's why on the 21st of March, I said that we should remain alert and persist in our fight against the epidemic. The experts have given us a valuable advice. I'd like to announce our initiatives in the use of Chinese medicine. We have made a request to the central authorities asking for another mainland team to come to Hong Kong to help us. This team will be Chinese medicine experts. That includes Professor Zhang Mingde, who is a well-known Chinese medicine practitioner in Guangdong province, also a head of Chinese Medicine University. We also agree with what mainland experts have told us. We'll draw reference from the approach of mainland in the use of Chinese medicine in treating COVID patients. Yesterday, Mr. Zhang Boli said that we should draw reference from the mainland practice and make good use of Chinese medicine. This will be an alternative path to enhance our effectiveness in treating COVID patients. I believe that with an additional team of mainland experts coming to help us, it will greatly boost our capability. Lastly, I'd like to take the opportunity to thank all those who have helped us. That includes staff members of the hospital authority. In the use of medicine, I would like to thank our experts in their advice in clinical use of medicine. And in terms of operation of holding centers, as well as the enhancement of the number of beds for COVID patients, I'd like to also thank doctors and medical personnel of both public and private sectors. I also would like to express my gratitude to non-government organizations as well as care homes. Before I finish, I'd like to appeal to you all to get vaccinated. If you have elderly people living with you or staying at care homes, please arrange for them to get vaccinated. As at last night, for those above the age of 70, only 71% of them have received the first dose, and only 57% of them have received the second dose. That means close to 280,000 elderly people in Hong Kong have not been vaccinated at all, which is not desirable. So once again, I'd like to appeal to you all that if you care about your family members and if you want to protect our healthcare system, please make arrangements for elderly people at home or staying at care homes to get vaccinated. I'll ask Dr. Ko, CEO of the HA, to talk about the HA situation before hearing from the Secretary for Food and Health, who will speak about the use of Chinese medicine in our fight against the epidemic.
Thank you, Chief Executive. Good morning, Hong Kong citizens. I'd like to give an account on the development of treatment for COVID-19. As pointed out by the Chief Executive, over the past few weeks, we have been providing more hospital beds which are dedicated to treating COVID patients. They now account for 50% of all beds in HA system. That is over 11,000 beds. And we also converted some hospitals into COVID-designated hospitals with the focus on Queen Elizabeth Hospital. Basically, those requiring admission and patients visiting our A&E unit who are COVID positive will be treated by us. As of this morning, the HA hospitals, together with the AWE Community Treatment Facility and North Lantau Hospital, we have 9,000 patients receiving treatment in these facilities. During the most severe period of the epidemic, many patients had to wait at the A&E unit for hospital admission and even peaked at some 1,000 patients at a time. The situation has improved. As of this morning, in relation to the number of patients waiting for more than 12 hours at A&E units in various hospitals, there are fewer than 100 patients. Now, at this peak for Queen Elizabeth Hospital, for example, some 300, 400 patients were waiting to be admitted. But this morning, the figure has dropped to a single digit. So we're seeing obvious improvement. As the epidemic situation is easing, we now see more non-COVID patients visiting our hospital, and at the same time, these patients may also need treatment at hospitals as well. And we'll closely monitor the situation. At Asia World Expo, we are grateful to the mainland medical support team for their support. And last week, upon their arrival, they familiarized themselves with our procedures. And then on Monday, close to 400 members of this so-called big team have started work in our facility. We are now having enhanced capability. Let me share this with you. Earlier, because of manpower constraints at the Asia World Expo, we took only 250 patients because of other elderly patients requiring care. And with the support of the team, we are able to receive 360 plus patients in the facility. Despite having a short period of time of teething in, the mainland medical team is now working seamlessly with us, and we look forward to further enhance our capability at Asia World Expo in the next 2 weeks for treating more patients. Every day, their team and our colleagues provide medical support around the clock, and every day we have doctors doing rounds, and the medical team would also hold clinical meetings and service meetings with us. And the medical personnel of HA, together with the mainland medical team, along with radiologists, would work in a concerted effort to further enhance our capability. For example, radiologists would help check the X-rays taken every day, and in terms of delivering medical reports, again, we see an apparent improvement. The other area of improvement, as pointed out by the Chief Executive, is at Asia World Expo. Apart from experts of different disciplines, we also have Chinese medicine experts helping us. For example, the Chief Executive mentioned Professor Zhang, a renowned Chinese medicine expert, is now leading a team to do rounds in our facility and providing treatment to our patients. And we also have a team comprising Chinese medicine and Western medicine experts. And we go through the patient's situation and discuss their cases together. I learned from Professor Zhang that, of course, medicine provides relief to COVID-19 patients. At the same time, Chinese medicine, in particular, is apparently helpful in controlling symptoms and helping chronically ill patients. And he also shared with us the experience in the mainland. For example, for respiratory symptoms such as sore throat, coughing, and other digestive problems, these are COVID symptoms. And for elderly patients, they may have indigestion, bloated stomach, and also fatigue, headaches, muscle weakness. And Professor Zhang has commented that Chinese medicine could provide relief. And we look forward to further collaboration between the two teams to enhance our service. At the same time, now you know that the Chinese medicine service is provided at Asia World Expo, and with the enhanced capability, we believe more patients will benefit. Apart from inpatients, we also provide treatment to outpatient clinics, and we also enhance our service capacity. As mentioned by the Chief Executive just now, in terms of antiviral drugs, we are now fully administering the two oral medication, molnupiravir of MSD and also Paxlovid of Pfizer. As of now, we have prescribed oral medication to over 15,000 patients. And we've also revised the drug administration guidelines. Regardless of the vaccination status, if a patient is above the age of 60, and if there are symptoms, they should make a booking and receive treatment at our clinics. For those below the age of 60, if they belong to a high-risk groups, for example, if they have not received all the necessary vaccine jabs, they should also come to our clinic for treatment. We also have immunocompromised adults. Regardless of the vaccination status or age group, we also appeal to them to receive treatment at our clinic. For molnupiravir, this drug arrived in Hong Kong earlier, so in terms of usage, this drug is higher, but now these two drugs are now on a par, and it's quite apparent that at designated clinics, the Pfizer drug is prescribed more frequently, whereas for residential care homes for the elderly, molnupiravir is mostly prescribed because of the different contraindications. And in the past few days, it seems that the demand for these two oral drugs has decreased. As explained earlier, we have 23 designated COVID clinics, and we provide over 4,000 quotas for booking every day. In mid-March, at its peak, some 3,900 Hong Kong residents used the quotas, but yesterday only 3,300 bookings were made. So the usage rate is 87%. We have sufficient quotas. And I appeal to everyone once again that if you are COVID positive and if you have symptoms, if you meet the criteria I just mentioned, please make a booking with our clinics. And then you can also use our mobile app and use the online platform to make a booking as well. You may also be concerned about higher risk patients and elderly citizens. We provide a caring queue for them, and we've actually reserved half of all the quotas at designated clinics. Let me cite some figures. Only about 700 to 800 of these high-risk patients have made use of these special quotas. We don't envisage a major problem, and we have learned from recent media reports inquiring whether private physicians can prescribe the drugs as well. In fact, private hospitals and private doctors have recently liaised with us, and we will make appropriate arrangements to make sure that the drugs can be prescribed to their patients as well. So be reassured. But the fact is, not many private doctors or hospitals would take care of COVID patients. Usually, COVID-positive patients will be referred to us. And with adjustments of our service, we will make sure that for needy patients, they can receive help at designated clinics. The other area is that for elderly residents in care homes, they can receive the necessary treatment as well. Say for a COVID-positive resident requiring treatment, through our mechanism, our team will be contacted and our outreach team will provide the necessary treatment, including the prescription of antiviral oral medication, and if necessary, the patient can be admitted to our hospital. And with the support of the government, we have more holding centers for elderly patients commissioned, and if necessary, we can help them.
We'll now hear from the Secretary for Food and Health. Good morning, everyone. In the fight against the fifth outbreak, we have made use of Chinese medicine in different areas and at different levels in the use in the treatment of COVID patients. Chinese medicine has played a great role. This is in line with our strategy, that is, to our core priority, as well as to reduce number of cases in different areas. We have invited the Chinese medicine sector to provide assistance for COVID patients, and they've responded warmly. I thank the central authorities in their support of the procurement of 3 types of over-the-counter Chinese proprietary medicine. I will now speak our work in 3 different areas. We work with the hospital authority as well as stakeholders of the Chinese medicine sector. We have mobilized everyone to implement our work. In terms of prevention, the Chinese Medicine Clinic Training and Research Center, one in each district, provide outpatient Chinese medicine consultation and supported services. They have also provided their services at the district health centers, as well as district health express. We have allocated $500 million for items related to fighting the epidemic. That includes supporting the Chinese medicine sector in the dissemination of information in the use of Chinese medicine. We organize training courses of Chinese medicine. We also support Chinese medicine clinics to enhance their anti-infection capabilities. We've also helped the Chinese medicine sector to make good use of technology in offering remote consultation services. There are different groups and experts in the Chinese medicine sector. They have provided advice in prevention and treatment or symptom alleviation of COVID infections. Well, they have disseminated information in relation to common symptoms of COVID, and they've also prepared some granules to alleviate symptoms. Plans have been made to produce them en masse. We have given them funding and support. We have also coordinated the distribution of these Chinese medicine prescriptions. In terms of treatment, let me tell you about our work. First, back in 2021, in January, the hospital authority in the community treatment facilities and the one at North Lantau Hospital, we have launched a service to patients with the use of Chinese medicine. We have combined Chinese medicine as well as Western medicine. So far, 170 patients have participated. We have offered over 940 treatment. In terms of isolation facilities, we have distributed proprietary Chinese medicine to those who are under isolation. At the same time, we have implemented a free hotline manned by registered Chinese medicine practitioners. Members of the public may call them to ask questions in relation to the use of Chinese medicine. Professional support is also given to members of the public in the correct use of such medicine. From mid-February, we have answered close to 3,000 calls, several hundred a day. Another area is in relation to those who are under home isolation or quarantine. In our resource kit distributed, we have added proprietary Chinese medicine. Those who are under home quarantine or isolation may, under the instruction of Chinese medicine, make use of these Chinese medicine in treatment. For those who are COVID patients staying at home, the FHB has previously announced that we made use of Chinese Medicine Development Fund to launch a special support scheme to enable Chinese medicine practitioners to offer remote consultation services to infected patients staying at home. That also includes distribution of Chinese medicines to them as well. Well, so far, over 20,000 people have benefited. And I'm aware that, well, since the inception of this service, everyone's working very hard. And I thank the central authorities for their support in the procurement of 3 proprietary medicines. They are 莲花清瘟胶囊、金花清肝颗粒 and 藿香正气. We have distributed, we have procured 1.28 million of such medicine. We will make use of different channels. We will distribute resource kits to those who are under home isolation or home quarantine. We distribute these materials and resource kits to those who are affected by a restriction and testing declaration, and to distribute these kits to those staying at care home.
Finally, on recovered COVID patients, it is very important for patients to recover fully, and Chinese medicine gives an edge in this regard in terms of reducing reinfection. In April 2020, the HA launched a special Chinese medicine outpatient clinic, and as mentioned, for the 18 Chinese medicine centers come training centers, they provide Chinese medicine services to COVID recovered patients for 10 sessions, and so far 4,580 recovered patients have used the sessions, and 14,300 consultation sessions have been provided. Of course, in the 5th wave, we're seeing a surge in the number of patients who have recovered from COVID, and We understand the need for this service, and every day several hundred patients used our service. Now, finally, as mentioned by the Chief Executive and Dr. Ko, the mainland medical support team comprises Chinese medicine experts as well. And as reported by Dr. Ko, Professor Zhang is now taking up the major task I mentioned, and Chief Executive just also mentioned that we will be inviting other Chinese medicine experts to come to Hong Kong and give us a hand. And we'll continue to make full use of the support provided by the central authorities to curb the spread of the virus in this wave and safeguard public health. We also like to thank the Chinese medicine sector for their participation. Our Bureau will continue to explore with the sector and hospital authority all feasible measures and step up our efforts, and depending on the Chinese medicine experts' advice, we will continue to adopt the strategy in the treatment of COVID. The floor is now open. If you want to ask a question, please raise your hand, and if your name is called, please first introduce the organization you represent, and please only ask succinct questions, 2 or 3 of them. This lady reporter on this side, yes. I'm from Hong Kong 01. Yesterday, at the Q&A session of the Legislative Council, the Chief Executive said that she had no idea about the regulations approved under the emergency ordinance by the Chief Secretary for Administration. Is there a lack of communication within the senior echelon of government? Second question, what are the areas of enhancements to be introduced? For example, will Chinese medicine be offered to inpatients? First question relates to lack of communication. In fact, yesterday at the Q&A session, the member asked a very specific question, that is under the Emergency Regulation Ordinance. On what occasions is this piece of legislation invoked, and for how many times? And in fact, the authority has been delegated to the Chief Secretary for Administration. So I think to give a more accurate account, the CSOA should issue a press release, which in fact was done in the afternoon yesterday. There were 3 occasions, and I also took part in it. The first one is for the mainland construction team to work on the Lok Ma Chau Loop site, including a temporary passage for the mainland construction team to come across the boundary. And in relation to the mainland team working hand in hand with the HA team in Asia World Expo facility, they should not be bound by the relevant medical laws in Hong Kong. In other words, they should not first apply for registration under the medical registration ordinance. Third, now, since we're giving support to residential care homes for the elderly, service should be provided within the premises. But then, because of isolation and holding centers, we grant exemption and allow operators of RCHEs to continue to provide service and take care of the elderly residents outside of the care homes. So I'm fully aware of these occasions, and you must bear in mind that we have short questions, short answers. I only had 3 minutes to answer the member's question, and despite all the succinct questions, only 22 members were able to ask questions during the session. So I was only able to give short answers. It doesn't mean that I'm not aware of what is happening. Now, the second point, as explained by Professor Chan just now, We have Chinese medicine experts coming to Hong Kong working on the 3 fronts, that is to reduce or prevent infections. In fact, yesterday, during the meeting with mainland experts, they mentioned that we are still having a very high risk, and I fully agree, because of the relatively lower vaccination rate among elderly residents and the prevalence of infections in residential care homes. So they will be giving us advice on preventing infection and reducing severe cases. The third point, which I find important, is to stabilize the condition upon patients' recovery. So I suppose these experts will be giving us advice on these 3 important areas. Next question. This lady reporter. I'm from Cable. Earlier, it was rumored that the vaccine pass would be extended to clinics and actually hospitals, including patients and visitors. Can you confirm this? Second, the anti-epidemic measures are expected to be relaxed by the 20th of April. And will the CE election take place on schedule? And if that is the case, Mrs. Lam, will you run for another term? For the second question, my answer remains the same. My heart and my focus is on fighting the epidemic at the moment. Earlier, we postponed the election for chief executive, and this date or the dates will remain effective. That is, nomination period will start on the 3rd of April. Now, vaccine pass is a means to boost vaccination rates. If you haven't received all the necessary jabs according to our schedule for the 3 jabs, of course, we cannot compel you to do so. But then we are creating inconvenience in terms of your daily living. And by doing so, we hope to incentivize you to get the jabs. In implementing the vaccine pass arrangements, we need to consider that there are premises that members of the public may visit urgently, and there are also urgent services to be provided. And we give full consideration before introducing vaccine pass for these premises. And you mentioned some premises such as the A&E unit, the hospitals, or for elderly patients to visit clinics to renew their prescriptions. These are premises of an urgent nature, and we have no plan to introduce vaccine pass requirement on patients. However, as far as staff are concerned, HA staff are required to get fully jabbed before they can provide service in these premises.
Next, the one in the middle at the back. I'm from Dot News. I have 2 questions. First, I'd like to ask about the latest situation at AWE. How many people in the mainland team are working there? And what is the situation in the cooperation between the teams of the 2 places? Are there new ways of treatment and care for COVID patients? Second question. For Chinese medicine remote consultation service, how many people have benefited? What is the effectiveness? Is it effective in terms of delivering much needed and appropriate service to those in need? I would first speak to answer your questions in general. In the promotion of the development of Chinese medicine, we have left no stone unturned. We have set up the Chinese Medicine Development Fund as well as relevant facilities. We have been actively promoting the development of Chinese medicine. In our fight against the epidemic, in different fronts, we try to make use of Chinese medicine as much as possible. And I thank the central authorities for their help. The mainland medical team has been providing assistance at the AWE in relation to the use of Chinese medicine, I would defer to Dr. Koh, who has already mentioned about this. And the use of Chinese medicine, I will defer to the Secretary. I'll speak in Cantonese. At the AWE, we are grateful for the support from the mainland medical team. When they arrived at the venue last week, they have immediately started their work. We've organized a familiarization tour to them. Actually, there was an advanced team from the mainland who have come before them. We have already prepared information kit to them, so they already know about the operation of our computer system. So their work has merged with ours seamlessly. Within just half a day or so, they have already familiarized themselves with the procedure, and they've started work on Monday in the care and treatment of patients. The 400-strong mainland team has been providing their services at AWE round the clock. They've also given us some new ideas in the treatment and care of patients, and they've been put into practice. Say, for example, we have made more use of O2 concentrator. We have procured several hundreds of such equipment. Previously, it was difficult to make use of the O2 concentrator because we had to use cylinders at the AWE. But now we can make use of the equipment to treat patients. And previously, as previously mentioned, we made use of Chinese medicine. We have mainland experts, including Professor Zhang. They worked with us and make use of Chinese medicine. They would do their rounds in the wards, and they would help with the assessment of the medical conditions of patients. Basically, every patient staying at AWE will be assessed by Chinese medicine practitioners and their experts. We think that with more experts arriving, the scope of service and the level of service will both be enhanced. Just now, Dr. Koh turned about the situation at AWE. In fact, at other venues and facilities, we have provided Chinese medicine services. Say, for example, at the community treatment facilities and those who are under isolation or quarantine at home, they have all been receiving different services and medication. As I've said, that we have the Chinese Medicine Development Fund. We have launched a program. Chinese medicine practitioners are subsidized to provide free remote consultation service. So far, 20,000 sessions have been provided. And it's just been launched for 2 days, so every day there are 400 or so. And in relation to the use of Chinese medicine at care homes, well, the HA has liaised with non-government organizations relating to Chinese medicine to provide Chinese medicine consultation services. We provide remote consultation service and outreach services to care homes. This is in line with our strategy to accord priority to elderly people. So far, 160 care homes have participated. We have provided over 3,200 consultation sessions. The one in the middle.
Mrs. Lam, Singapore's Prime Minister just announced a raft of new measures to ease pandemic curbs, including lifting most restrictions on fully vaccinated visitors and removing the mask mandate outdoors. So when will Hong Kong do the same? And has Hong Kong permanently lost its crown as Asia's global hub to Singapore? And also, you said yesterday that Hong Kong's top priority is still reopening its border with mainland China. Well, earlier you talked about the importance of Hong Kong as an international financial center. So can you clarify, is it necessary for Hong Kong to first open quarantine-free travel with mainland China before opening quarantine-free travel with the rest of the world? Thank you.
Well, first of all, let me make it very clear that Hong Kong remains a very attractive global financial center, a very attractive global and regional aviation hub, and also a very good place to live and work. I remain very confident that after the epidemic situation, that Hong Kong will be able to welcome a lot of talents to come to Hong Kong, whether in the financial sector or more recently in the technology sector. As you have heard me referring to some of the successes we have in recruiting top talents to come to Hong Kong to work in our universities on science and technology. But we are going through a very difficult period with the fifth wave of the COVID-19 epidemic. But with the support of the central government and all this assistance rendered to us in the last 2 months or so, and the cooperation of the people of Hong Kong, I think we will rise to the challenge. As I also said on many occasions, the policies and measures to be adopted by each government in combating COVID-19 epidemic differ. I don't think there is a one-size-that-fits-all. I also don't believe that there are only two pathways. That's why I said that perhaps it's not very meaningful to ask us to choose whether you are going for route A or route B. We will have to adjust and do whatever is in the best interest of Hong Kong. And in terms of opening the border or resumption of travel, the best interest of Hong Kong is to do both, that we maintain our connectivity with the rest of the world through the aviation side, but at the same time, we also continue to perform the role of Hong Kong being the basis for businesses and individuals to access the mainland market. And knowing the very prudent measures adopted by the mainland and also the aspirations of the Hong Kong people, not only for the business purpose, but also for family, personal, and social purposes, towards the end of last year, we did work very hard in trying to resume quarantine travel into the mainland first. And I have told you many times that we were at a very advanced stage of announcing such a scheme. So I remain very optimistic that once this wave subsides, we will pick up on the earlier discussions, and at the same time, we will be able to open up to the rest of the world. My announcement 3 days ago to lift the place-specific flight suspension was very much welcomed by the aviation sector and by people who are affected by the flight ban. So wherever we could, we will react in a very pragmatic manner to preserve what is so very important to Hong Kong, and that is her international connectivity and accessibility into the mainland. Thank you.
好，下一條嘅提問。
Next question. This reporter in the front. I'm from Now TV. A follow-up question. Now, Chief Executive, you said the CUT would be suspended, and yesterday, yet you said that you may reconsider whether to do it. What about the Huoyan laboratory? Will these laboratories be on standby? And there are comments that this will cause a wastage of resources and manpower. And what is your comment? Next, about reintroducing the compulsory testing notices. Now, if the government has already acknowledged RAT results, why is it necessary to roll out CNTs again? Are there any changes to the criteria of issuing CTNs? On the 21st of March, we announced a package of measures which are interim measures. I would say these two questions of yours relate to the measures. At the time, mainland experts and other experts also agreed that for a compulsory universal testing program, it should be introduced at the initial stage of a wave of epidemic so that we can isolate the infected as soon as possible to curb the transmission chains. However, the fifth wave of the epidemic in Hong Kong emerged really quickly, and it was impossible to introduce compulsory testing then. And according to experts, the CUT can also be conducted at the end of an epidemic wave. That is, by the time when the number of infections have dropped, we can once and for all conduct comprehensive and compulsory testing to curb the infections. However, such testing should not be conducted while the epidemic situation is still raging. It's a matter of efficiency, not a matter of our capability. So we did not do it at the initial stage. We should now refer to the second scenario. If towards the end of the wave, if universal testing is deemed effective, the SAR government will not stubbornly say no to it. So at the moment, it's still just suspended. And we are, in terms of preparing the CUT, still finalizing details. We are, for example, consulting the relevant government bureaus and departments about the manpower available and the several hundred testing centers to be set up. We have gone through all these steps. It's not a waste. These are necessary steps in our preparation. And it's not a waste of manpower after all, because we have a fleet of 180,000 civil servants all standing by to fight the epidemic. It's not a waste of resources or manpower. Earlier, our local laboratory operators were very helpful. Apart from their own premises, they've also acquired premises, sports centers from us to build Huoyan or temporary laboratories. But now we've seen a drop in the number of PCR cases requiring confirmation at laboratory. In fact, in the past, there used to be 80,000 to 100,000 tests conducted a day. At the moment, we do have spare capacity of these laboratories. So for the Huoyan laboratories or the personnel, they are invited to come over across the border to help out by private lab operators. I would say that they will handle the situation themselves and will continue to liaise with them. And that if there is no need for the manpower and resources to stand ready for the PCR testing, then they should not remain in Hong Kong, because I suppose a similar testing capacity is needed on the mainland. Well, we all understand the dire situation in the end of February, and the CTN arrangement was suspended. If the result couldn't be ready in 24 hours, it would not be meaningful. And now the situation has ebbed, and we should use this useful tool again to help us identify infectious cases. For RAT rapid antigen tests, all along we maintain that it is a complementary measure. Whether or not we have the capacity to conduct PCR tests, we should continue to do so. So we will continue to have PCR tests. As for the criteria for issuing CTNs in relation to buildings and premises, the criteria haven't changed, as I understand. There are a number of factors to consider. For example, whether there are a number of or a certain number of COVID positive cases in a certain building or premises, leading to a concern that there may be an outbreak. The other factor is, according to sewage surveillance, there is indication that the viral load of that building is quite high. The fact is, we may not have RTD capacity for buildings with higher viral load, because an RTD operation affects residents much more so than a CTN arrangement. Because for RTD operation, the area will be closed off, whereas for CTN, residents can go and get tested anytime. So that is why we encourage members of the public to report a positive case if they test positive themselves. At the same time, we should continue to rely on PCR and the CTN. But that's the end of today's briefing, and we'll see you again at 11 tomorrow.